Going to discuss today, we are going to discuss today is about cranial nerves, right? First six cranial nerves. First six cranial nerves include, the first one is olfactory nerve, second is optic nerve, third is oculomotor, fourth is trochlear, fifth is trigeminal, and sixth is abducent nerve. The examination of among the examination of these first six cranial nerves, the commonest nerves which are given to you in exams for examination, they are commonly second nerve, optic nerve, the third one, oculomotor nerve, and on occasions, some examiners may ask you to perform examination related to trigeminal nerve. For remembering how many things you are going to perform when you will be examining these nerves, remember the simple formula that you have to do 4 things while examining optic nerve, 4 things while examining oculomotor nerve, and 4 things while examining this trigeminal nerve. The first nerve is very simple in examination, that is known as olfactory nerve. So that is related with perception of smell. So what you are going to ask the patient, you are simply supposed to ask the patient whether he can perceive different smells and he can differentiate different smells or not. If patient gives you that answer, that he can appreciate different smell, like a smell of soap is different from smell of peppermint, smell of ammonia he can perceive in a different way from other smells. If patient tells you that he can comfortably perceive these things, you are not supposed to perform the examination. Remember this thing, you are not supposed to perform it. But if patient claims, I feel difficulty in differentiating these things, then you will be performing the examination. The examination rules are like you have to examine the 2 nostrils separately, because you want to know from which nostril is affected, whether this smell is affected in both nostril or one nostril. Because the lesion which usually lies in the setting of olfactory nerve lesion is in the cribriform fossa or plate lesions mainly, frontal lobe lesions mainly, right? So sometime in the state of trauma, a patient can have lesion which can ultimately lead to anosmia, means loss of smell, or parosmia, means odd kind of perceptions of smell. So how you are going to perform the examination? First, you will be asking the patient to close one of the nostril. So close one of the nostril and blow air, just like that, blow air. What I am going to do by doing that way we'll be knowing whether the nostrils are open, adequately open or not. Because if they are closed, obviously patient won't be able to perceive things otherwise. So one by one, we will be asking the patient to close one nostril each time, and that way we can assess their patency. After assessment of patency, now what I'll be doing next, I'll be taking a piece of soap and I'll be asking the patient to close one of the nostril. I'll be I'm having a soap in my hand, I'll be bringing it close to the nose and I'll be asking the patient whether you can perceive its smell or not. His eyes should be closed. And same way, I'll be checking it in the other nostril. Then I will try another, say, pungent smell, like we can try this peppermint. So that way, we will be assessing the olfactory nerve. So it's a simple nerve. Usually in exams, examiner won't be asking you to examine this olfactory nerve, but rarely you can get that command, so you should be knowing it. The next is then, important one is optic nerve. There are 4 things you are supposed to examine in optic nerve. One is fundoscopy, second is visual acuity, third is visual field, and fourth is color vision, right? So as far as fundoscopy is concerned, what you are going to do with the fundoscope, you are obviously supposed to examine the retina, but as far as your final year is concerned, usually they do not ask anything related to fundoscopy, and you guys don't have those fundoscopes with you in exams. But lately, as you will be going in eye ward, obviously you will be learning a lot about it, and they will be telling you the whole details. So we will be focusing on the remaining 3 things. Visual acuity. So there are two things which you assess. You assess the near vision and you assess the far vision. For assessment of far vision, the rule is simple. You will be asking the patient to read the Snellen's chart. You must have seen this Snellen chart while going in your eye units or in physiology. You must have gone through this thing. So Snellen chart is basically at a distance of 36 feet, and you read certain things written on that Snellen's chart. There are 6 lines on that Snellen's chart. The first line is having letters which are of bigger size. The second one is then having comparatively smaller letters, and that way there is a decrease in size of letters line to line. But here what we'll be doing, there are few modified Snellen's chart as well. You can buy these charts from medical market, or sometimes in eye units you will be able to find these charts. These charts have 6 lines written over like in the same way Snellen's chart is. These modified Snellen's charts, there are 6 lines on these charts, and they are analogous to those standard Snellen's chart. At a distance of 1.5 feet, you will be placing that Snellen's chart in front of the patient, and obviously you have to assess the visual acuity in both eyes separately. So you will be asking the patient to close one of his eyes, and with the single eye he will be reading the first line, second line, third line, fourth line, fifth line and sixth line at a distance of 1.5 feet. If say he is not able to read first line, second line, third line, so depending on that situation we'll be having an assessment that patient is having 4/6 vision, 2/6 vision. If he can read all the 6 lines, we'll be writing down as 6/6. Vision is 6/6. If first line cannot be read by the patient, then 5/6. If second one is not read by the patient, then 4/6. That is how you interpret your findings. The step next is then visual acuity, near vision. How we'll be checking this thing? If patient is educated, you will be asking him to read certain lines for you. So you can give a newspaper to the patient. Say this is a newspaper, I'll be asking the patient to read some lines for me, and obviously this near vision will also be checked one by one in each eye. If patient can read it, well and good. But if it's not possible for the patient to read that thing, what next? Then we'll be seeing visual acuity, whether he is able to perceive, whether he is able to calculate fingers or not. Like how many fingers I'm showing to the patient. That place one of your hand on one of your eye. Tell me how many fingers are these?
These are 4.
These are 4. How many are these?
3.
These are 3. Finger counting. So next thing is finger counting. If patient can count fingers, it means visual acuity. What we are going to ask the patient, we'll be asking him to count the fingers for us. If he can count fingers, well and good. If he cannot count fingers, then what I'll be asking? I'll be asking the patient that just close one of your eye. Tell me whether this hand is moving or it's still. So this is what I'm going to ask the patient. If he can perceive hand movements, well and good. If he cannot perceive hand movements, then there will be step next. So these are the 4 steps basically. The step next is I'll be throwing light on his eyes from different directions, and I'll be asking the patient from which side you are perceiving light, right? So whether patient is able to perceive light or not, I need light. So I'll be throwing it from one side, then I can throw the light from the top position. So what we'll be doing, close one of the eye and tell me from which side you are perceiving light.
From left.
Okay, now from which side you are perceiving light? From top, right? So this is how we'll be asking the question. If patient can only perceive light, so what I'll be saying the visual acuity of right eye of this patient is limited to light perception. If patient can count fingers, I'll be saying the visual acuity of this patient is limited to finger counting, but he cannot read. So that way you interpret your findings, and one by one you will be checking both eyes. The step next is then visual field. There are two ways you can assess binocular visual field and you can assess unilocular visual field. It would be better if you perform one thing at one time. In exam you have got short time, so we'll be assessing this visual field in one eye at one time, right? So what we'll be doing while we'll be examining that visual field, actually the best way to assess the visual field is perimetry, but as we are not having this thing available with us during exams, so it's basically patient and doctor visual field assessment based on the comparison, right? So I'll be comparing my visual field. If I know that my visual field is normal, then I'll be comparing my visual field with the patient, and that way we'll be having an assessment whether his visual field is normal or not. So what we are going to do here, I'll be asking the patient to close one of his eyes, and I'll be closing the same eye. So close your left eye, sorry, I'll be closing the opposite eye. Our side should be the same. So here, it's my left eye and patient's right eye, which we are comparing right now. What I'll be doing, I'll be asking the patient, I'll be bringing my finger from multiple quadrants towards that eye. Place your this hand, we check that way. So I'll be bringing my finger inward from different quadrants. Like I'll be bringing my finger from upper right quadrant, from lower right quadrant. I'll be moving horizontally, I'll be moving from vertical position to downward position. That way I'll be moving my finger, and I'll be asking the patient, when I am able to perceive the movement of my finger exactly at that time, I'll be asking the patient whether you can perceive its movement or not, right? What you are supposed to do, you are not simply supposed to ask whether you can see finger or not. You will be asking the patient whether you can perceive movement of that finger, right? So place your hand like that. Whenever you are able to perceive the movement, tell me, okay? When you are able to perceive, okay, right?
Yes.
Fine. When you are able to perceive, right, okay.
Yes.
Whenever you are able to perceive, fine, right. So in the same way, we'll be placing hand on the other eye, and again we'll be assessing this visual field. And then if I can perceive movement of finger earlier and patient cannot perceive that movement at that time, he perceive it lately, I'll be giving my interpretation like that the patient is having reduced visual field in the left upper quadrant, reduced visual field in the left lower quadrant. That is how I'll be interpreting my findings. So that is about visual field. Then as far as color vision is concerned, we'll be using Ishihara chart. So that's a chart which is having different colors, and we just ask the patient, can you differentiate different colors? So if patient can differentiate different colors well, it means his color vision is normal, and obviously we'll be assessing color vision in different eyes separately, right? For ease and your comfort, you just need to take, if you do not get that Ishihara chart, you simply need to take 3 charts of different colors, different standard colors. The standard colors are red,
blue or
blue,
green.
and green. So you will be using these 3 colors. You will be just in need of a stapler. So staple these 3 different colors. I'll be placing right in front of you. I'll be asking you to close one eye, and then I'll be asking you to identify these colors separately. So small pieces of those charts, and you can ask the patient whether you can differentiate these colors or not. So that is how we'll be examining this second nerve. Now we come to the third nerve. As far as examination of third nerve is concerned, again there are 4 things which we'll be examining. The first one is we'll be focusing on the patient eye and we'll be looking for ptosis. The second thing is we'll be examining for light reflex. The third thing we'll be examining for accommodation reflex. And the fourth thing, extraocular movements. And when we'll be checking the extraocular movements, we'll also be checking the nerve number 4 and nerve number 6 in addition to nerve number 3, which is trochlear nerve and abducent nerve. So first we start with examining at the eyes of the patient. We'll just be looking for ptosis. So if a patient's oculomotor nerve is affected, say on one side, that side will be having ptosis if there is involvement of these extraocular muscles. This is simple based on observation, right? The second thing is then light reflex. So what I'll be doing, I'll be checking for direct light reflex and I'll be checking for consensual light reflex. So these are two things which we'll be doing. What I'll be doing, I'll be throwing light in eyes of the patient from sideways, by moving sideways towards the eye, right? It shouldn't be thrown like that. So what I'll be doing here, I'll be placing my hand like that, and now I'll be seeing the direct light reflex that way, and I'll be seeing the consensual light reflex in the other eye. Same way, I'll be placing my hand like that. Now I'm seeing the direct light reflex in that eye, and at the same time seeing the consensual light reflex in the other eye. That is how you examine the light reflex. Then the second thing after light reflex is, the third thing after light reflex is accommodation reflex. In accommodation reflex, what you are going to do? In accommodation reflex, you'll be asking the patient to see a thing present at a certain distance, which is far from the patient. Say on that wall, there is a picture of Qaid-e-Azam. So you just see that picture, fine. Now see my finger. So what I have done here, so I have asked the patient to see an object which is at a distance, and then immediately I ask the patient to see my finger. So what two things will happen? One, the eyes will converge, and second, the pupillary size will reduce. So if these two things are happening, it means accommodation reflex is intact in the patient. And now one of the most important things. Many a time in exam, the examiner will simply be asking you to examine the patient's extraocular muscles. It means, in other words, you are examining a portion of third nerve, and besides that, you are examining the fourth nerve and sixth nerve. So we'll be examining these extraocular muscles now. So how to perform this? What are the steps involved? What I'll be doing, I'll be making basically an H, and in that way I'll be assessing different extraocular muscles. So what you're supposed to do, you're not supposed to move your head. I'll be placing my finger in different position. You are simply supposed to move your eyes. Wherever my finger is going, you are simply supposed to move your eyes. Don't move your head, right? So just look towards that finger. So that way I am having an assessment. So there is a central line, and then upward, and then downward, right? So that way I'll be assessing his extraocular muscles, and you need to memorize what kind of movements are carried down by different group of muscles. So if it is inward movement, that is with the medial rectus. The movement on this direction is with the lateral rectus. If laterally the movement is upward, laterally upward, this is by superior rectus. Laterally downward, this is by inferior rectus. But in the midline, when I am moving my finger like that, in the midline, the upward is movement with inferior oblique, and the downward movement is with superior oblique, right? So remember these things. So that was all about this third nerve, fourth nerve, and sixth nerve examination. And now the one last nerve, that is trigeminal nerve. The trigeminal nerve, again 4 tests. One is the sensory component of trigeminal nerve. One of the division is ophthalmic. The second one is maxillary, and the third one is mandibular. Spare that C2, C3 area, angle of jaw. So that is not supplied with that trigeminal nerve. The second is we will be examining for jaw jerk. The third is we will be examining for muscles of mastication. And then fourth thing is we will be examining the conjunctival reflux. I will not be checking the corneal one, because if you keep on touching the cornea, patient, that may irritate the patient. That may disturb the cornea as well. So we start with the examination of one of the components of that nerve. First we assess the muscles of mastication. So if we want to examine this temporalis, masseter, I'll be asking the patient to clench your teeth like that. Right, so I am palpating here and the muscle becomes stiff that way. How to assess the pterygoids? I'll be asking the patient to move his lower jaw on one side like that. More lower jaw on one side, fine. And I'll be pushing it towards the other side. The rule is the same. To assess the power of any muscle, ask the patient, put the muscle into action and check against resistance. That's the protocol, right? Put the muscle into action, check against resistance. So he basically moved towards that side and I was checking against resistance. Now I'll be asking him to move his lower jaw towards this side and then I'm trying to push it towards the other side. So that way you will be examining the pterygoids. Jaw jerk. For assessment of jaw jerk, what I am supposed to ask the patient, I'll be asking him to open his mouth. I'll be placing my thumb over the chin and I'll be open the mouth. So what I have done here, if it is positive jaw jerk, patient is having upper motor neuron lesion of the trigeminal nerve, there will be sudden closure of the mouth. But if it is normal, there is no such lesion, then as I will strike, it will not close with a sudden jerk. The next thing is then conjunctival reflux. So you know where is conjunctiva. I'll be seeing that conjunctiva and I'll be touching it with this cotton. So as soon as I'll be touching it, what will happen? Blinking. There will be blinking, right? So that indicates normal conjunctival reflux. It's a reflex phenomenon. As soon as something falls in your eye, immediately you close your eye, blink your eye. The same way the conjunctiva. This is very sensitive. As soon as you touch it and reflex is there, the patient will be closing his eyes immediately. And then the last thing, the sensory component of the trigeminal nerve, ophthalmic division, then this maxillary division and this mandibular division. Will be assessing trigeminal nerve on both sides separately, right? So there will be just two tests needed. One which will help us to locate the level of lesion and which will help us to identify whether the posterior column of the patient is working appropriately or not. Like the posterior column is carrying the sensation of vibration, proprioception and fine touch. But we'll just be checking fine touch here. For lateral column, so the spinal cord will be making an assessment of pain here. So there is no need to examine pressure and temperature here. So one sensation to be performed here. First fine touch. For fine touch, we'll be using a cotton swab. We'll be taking a cotton swab and we'll be examining that way. First we'll be asking the patient, as we are going to examine the face of the patient, so we are not going to place it right over the face and we'll be asking whether you can perceive this fine touch or not. Rather what I'll be doing, I'll be asking the patient, can you perceive it? Yes. There is a fine touch on your body, can you perceive it? Right. And if hand of the patient is normal, there is no such pathology, I can ask the patient, can you perceive it? Close your eyes and tell me, can you perceive a sensation of fine touch? Touching this cotton is touching over your dorsum of hand, and you will be asking the patient to close the eyes and you will be asking whether you are able to perceive it. Now what I'll be asking the patient, I'll be asking the patient that you are supposed to close your eyes for me. I'll be touching your face, different areas of your face with that cotton, and as soon as you feel your face is being touched by the cotton, tell me immediately whether you are able to perceive that sensation or not. So close your eyes. So are you able to perceive anything? Tell me immediately.
Yes.
Where? On your forehead, left side of your forehead. Fine.
Yes.
On
Cheek.
which area? On your cheeks. This is basically the maxillary portion.
Yes.
You are able to perceive this fine touch sensation on which area?
Jawline.
On jawline. Fine. So that is how you will be asking the question. Eyes will be closed. I'll be examining both things separately. But as you are going to perform anything related to the sensory system examination, education is of key importance. First, you need to educate the patient. And if you have educated the patient well, the things become very easy. So if you have told him clearly that this is what I want to ask from you and this is how you are going to tell me about these perceptions, then the things become quite easy for you. Always educate patient in appropriate way. So do we have a toothpick with us? Toothpick, thank you very much. So now we'll be examining the sensation of pain with toothpick, right? Uh, toothpick with toothpick will be having an assessment of pain sensation, right? So what I am going to do, I'll be, or in other words, you need a common pin. Common pin, one end of the common pin is sharp. It carries sensation of pain. The other end is blunt. And I can sometime try the sharp end, sometime I can try the blunt end, and I'll ask the patient whether you are able to appreciate this blunt end and whether you are able to appreciate the sensation of pain or not. This is what I'll be asking from the patient, right? So close your, but first obviously I'll be asking the patient, I'll be placing it on preferably on his sternum, neck, and I'll be asking the patient whether you can appreciate the sensation of pain so that he'll be knowing what kind of sensation of pain is. So can you appreciate the sensation of pain?
Yes.
So if patient can appreciate that sensation, what I am going to do, I'll be touching different parts of your face with that common pin, and you need to tell me that whether you are able to perceive the sensation of pain or not. Sometime I'll be touching it with a blunt end. So if it is with blunt end, obviously then you will not be having that sensation of pain. So I am again touching it with the blunt end. Can you appreciate this blunt portion as well?
Yes.
Right, fine. Okay, so close your eyes. Now I am going to. So can you perceive anything?
Yes.
Is it pain sensation or was it blunt?
It's a pain sensation.
Pain sensation, fine. Is it sharp or blunt?
It's sharp.
Sharp, right. Sharp or blunt?
Blunt.
Fine. Close your eyes. Sharp or blunt?
It's blunt.
Fine, right. So that way, patient can perceive the sensation of pain, right? So this is how you are always supposed to tell patient first. You can use, preferably you should be using these common pins with a blunt and sharp end. But nowadays, most of the neurologists, they always ask us to examine with these toothpicks, as patients many a time are not comfortable easy with those common pins. Thank you very much.